Hello, my name is Victoria. I am a pharmacist at LTHT and a PhD researcher at the University of Bradford. Today, I will be presenting our research on the facilitators and barriers to implementing pharmacogenomics guided care in hospital for older patients. Pharmacogenomics aims to use a person's genomic information to personalize drug therapy and prevent adverse drug reactions. Older patients are particularly vulnerable to adverse drug reactions due to factors such as frailty, multimorbidity, and polypharmacy. And we know that pharmacogenomics guided care can significantly lower the risk of experiencing adverse drug reactions in older patients. The aim of my qualitative study is to describe how patients, doctors, and pharmacists view the idea of pharmacogenomics guided care for older people in hospital. To explore this, I conducted semi-structured interviews that would last 30 to 60 minutes with patients and healthcare professionals. And so this included 9 inpatients, all aged 65 and over at one site, and 5 hospital doctors and 6 hospital pharmacists over 2 hospital sites. I use thematic analysis as a method for analyzing the interview transcripts to derive recurrent themes. I used the framework approach to help me organize the data and identify the commonalities, differences in the data, and derive themes. I'll now discuss the themes that were developed from the patient interviews and healthcare professional interviews. So, the 3 main interviews that were developed from the patient interviews were information delivery, standard of care, and participation in care. So the first theme, information delivery, and that pertains to pharmacogenomic testing, how information was delivered to patients. So patients expect healthcare professionals to assure them that pharmacogenomics guided care had been tested before offering it to patients. They wanted to feel assured that the pharmacogenomics test is not experimental and that recommending the test is justified. Patients had different information seeking habits and therefore require different amounts of information to be confident about consenting to a pharmacogenomic test. And they want pharmacogenomic to be tailored to their needs so that they can determine so that so healthcare professionals and patients should be able to determine what type of information that patients need. Patients generally understood the purpose of pharmacogenomic testing, but some patients were still unsure and would like to know what to anticipate after a pharmacogenomic test was conducted. Patients also expect healthcare professionals to manage the expectations of pharmacogenomics guided care so that they are aware of the implications of the test and information they would like to know if they would still experience side effects, for example. The second theme is standard care, and it explores how patients expect healthcare professionals delivering pharmacogenomics guided care to work in terms of their expertise. How patients inherently trust the healthcare system and want to see healthcare professionals collaborating. When patients were asked what they would expect pharmacogenomics guided care to look like, a lot of them expected healthcare professionals trained and experienced in pharmacogenomics to be the ones to deliver the service. Many of the patients trusted the abilities and intentions of healthcare professionals to deliver pharmacogenomics guided care, and as a result, were comfortable with receiving pharmacogenomics guided care. The confidence patients have in healthcare professionals means that they are willing to accept care or treatment recommended by a healthcare professional. However, patients did not always have positive views of pharmacogenomics guided care. A patient did share a sense of distrust, but this was in the clinical intervention rather than in healthcare professionals. The patient had experienced clinical interventions that did not work and as a result was not keen on the idea of another test or clinical intervention. Some patients want to see multidisciplinary and cross-sector collaborations in delivering pharmacogenomics guided care. And the reason that patients wanted to see collaborative working was because they believed it would help healthcare professionals make better decisions. Some patients highlighted cross-sector working by expressing the importance of including general practitioners, their GPs, in pharmacogenomics guided care so that they were aware of the of the care that patients were receiving and were expected to monitor the patient. The third theme is participation in care, and it explored patients' desire to be involved in pharmacogenomics guided care, and some saw it as an opportunity for them to contribute to the progress of healthcare. Participation, so patient involvement and a sense of contribution to advancing healthcare were the sub-themes in this theme. Patients wanted to be involved in pharmacogenomics guided care and wanted to see that decisions were not made without their input. Patients perceived decisions made without their input um, as a bit rushed, and it would make some patients be less confident about being involved in um, pharmacogenomics guided care. Patients want to feel that having a pharmacogenomic test was their decision. The experience or idea of having a medicine imposed was expressed by some patients, and um, as how they would feel if they were not included in decisions about their pharmacogenomics guided care. Some patients have felt a sense of contribution, a contribution to progress, if they consented to pharmacogenomics guided care. Some patients believe they were contributing to the progress of healthcare or their own care if they accepted pharmacogenomics guided care. The next themes I will share are three main themes derived from the healthcare professional interviews. So the first theme examined the level of interest in the idea of pharmacogenomics. Pharmacists and doctors largely showed optimism about pharmacogenomics guided care. They described their emotions as being happy or excited about the prospect of pharmacogenomics guided care, and a lot of them showed curiosity and were open to learn more about pharmacogenomics. However, some doctors and pharmacists were more cautious in their optimism because they felt that pharmacogenomics guided care is unlikely to be a reality, or at least not in the current healthcare system. One doctor said pharmacogenomics guided care sounded futuristic and pipe dreaming. A pharmacist said it would be great if it worked, but didn't believe or think the healthcare system was there yet, and there was still more work to be done. All the doctors and pharmacists could visualize the benefit of pharmacogenomics guided care in their own clinical practice and often associated benefit to a specific medicine that they prescribed or that they recommended in their current clinical practice. The second theme is about the pressure on the workforce and its impact on the adoption of pharmacogenomics guided care amongst doctors and pharmacists. The doctors interviewed were concerned about the potential impact of implementing pharmacogenomics guided care on a healthcare system with operational pressures. And another commented on pharmacogenomic testing being a possible burden. So you can see a general concern for the practicality of using pharmacogenomics in hospital. Doctors are worried that um, that the hospital is already under a lot of pressure and staff are already overstretched. So implementing pharmacogenomics testing could be seen as a burden. The final theme examines the support that doctors and pharmacists feel that they would require in order to deliver pharmacogenomics guided care. So pharmacists and doctors want pharmacogenomics to be integrated into the existing workflow. And this indicates that they would like pharmacogenomics guided care to be introduced into practice, but in a way that is least disruptive to their normal way of doing things. They wanted support, such as in-house sessions where they could ask questions, in-house advisory service where they could consult that they could consult and space to have dedicated, allocated time to learn about the application of pharmacogenomics to their practice. So in conclusion, our study provides valuable insights into the facilitators and barriers to implementing pharmacogenomics guided care for older patients in secondary care settings. It emphasizes the importance of delivering evidence-based information, involving patients in decision making, and providing support for the workforce. Addressing operational pressures and maintaining patient trust are critical to overcoming barriers and promoting facilitators for the successful implementation of pharmacogenomics guided prescribing in hospital settings. Thank you for your attention. I am now happy to answer any questions you may have in the comment section. Thank you.